and I'm very inspired that you're around and very inspired by you and your team. I'm going to share the screen for my presentation. And here, I'll begin soon. Can you please let me share the screen?
Yes. Sweta, please also assist that side.
You need to make me the host, Sumangle, then I can do the, I can do the sharing then.
And also just to briefly introduce my colleague Sweta, who is the Global South focal point of the Global Youth Biodiversity Network. And we are currently chairing the session together.
Great.
Thank you so much, Gladys, for joining. We're really excited for your talk.
Okay, thank you.
Sumangle, you just have to go to my name and then say,
yeah, it should be done right now. Yeah.
So now I can try to give. You should be able to share your screen now, Gladys. It says there's a green button with, perfect.
Okay, I'll do it now. Here I am. Okay, so thank you so much for inviting me this afternoon to talk about how we are working at Conservation Through Public Health. And we set up the organization because we were concerned about disease transmission between people and wildlife and the effect that it can have on conservation, ecotourism, sustainable agriculture, and livelihoods. So since this is also oriented towards COVID-19, which is actually enabled people to understand better why we're doing what we're doing, I'll be talking about COVID-19, but I'll also talk about one or two other diseases that we've handled as Conservation Through Public Health to reduce its impact in conservation and tourism. So COVID-19 is considered to be one of the bat coronaviruses, but the immediate host hasn't yet been determined, although some people think it's a pangolin. And there've been news already that China markets have reopened, and there's been a lot of debate in the conservation community about whether these markets should be allowed or whether they should be better regulated. But that's not something that I'm really touching on in the presentation, but it's something that comes up and we have to think about. And the very first, one of the outbreaks that have occurred in the past, which also created a pandemic, because it moved from epidemic, which was in one country, to other countries, but not as much as COVID-19, was SARS, severe immune respiratory syndrome, and MERS, Middle East respiratory syndrome. And in both of them, they had intermediate hosts, like a civet cat with SARS, and MERS had a dromedary camel in the Middle East. And a lot of people are saying, is it from a bat? Is it from a pangolin? It's likely from a bat, but what was in between the bat and us to create SARS? Where did SARS-CoV-2 jump from, which is a causative agent of COVID-19, in order to get from bats to people? And that's what everybody's trying to find out. Scientists are looking into this. And coronaviruses are RNA viruses, which means that they can easily mutate, easily settle in any cell, and easily transfer. So in the Wuhan wet market, the people who have visited it say that it's horrible. Like the animals are in tiny cages, and the people, it's so congested and crowded that it's a perfect condition for diseases to jump from species, within species, and from animals to people, because it's very crowded. And some people say just for health reasons, they don't want to go there, even if they live nearby. The wild animals are stressed, and when they're stressed in tiny cages, they start to shed viruses, such as the coronavirus. And with everyone, I think that's the reason why we now have this pandemic. And although the main spread is through droplets, they found that even after somebody has recovered, they can still find the virus in their feces. So fecal contamination is coming up as some other area to prevent the virus from spreading. So I've been working with the mountain gorillas since I started as a vet student in 1994 and right up to now, I'm still working with them. I hope one day you get to visit them if you haven't yet. It's a once in a lifetime experience. When I first started working with them, there were 650, and now there's 1,000, almost 1,200. There's 1,063, so the numbers are almost doubling. And mountain gorillas, even if the numbers are very small, it's the only gorilla subspecies which is growing in number. All the other 3 subspecies, the eastern lowland in DRC, the western lowland in West Africa, and Cross River gorilla found in Nigeria and Cameroon, the numbers are going down, and people think it's because of, one, because there's no tourism and they don't have enough protection. And we're really pleased that in Uganda and Rwanda and DRC, the numbers are going up. And in Uganda and Rwanda, there's a very active and viable tourism, such that it's contributing to over 50% of the revenue for the Uganda Wildlife Authority, and possibly and Rwanda as well. So gorillas are now considered a major part of the economy. And actually last night, the president gave an address, COVID-19 address, like is happening in all other countries with presidents. And one thing he did say is that he's sad that COVID-19 has affected tourism, because Uganda gets $1.6 billion a year from tourism, and it then gets like $1.3 billion a year from coffee and other products. So generally, tourism is still the greatest earner, but it's been affected. But he's saying that coffee and other products are not affected because agriculture has not been banned. It's only tourism and everything else, other service industries that have been banned because of COVID-19. And gorillas, wherever they're found in their ranges, are threatened by habitat loss. When you come to Bwindi, you see this very hard edge. When the park was created, people were not allowed to go in anymore. It used to be a forest reserve where they could go and cut trees sustainably. Then it was upgraded to a national park when they realized that actually we have very important species like the mountain gorillas. There's also chimpanzees, there's elephants, many species of monkeys, and also birds. There's over 300 species of birds. So, and on top of the forest providing water for everyone, it's an important source of water and stabilization of climate change. So it was upgraded to a national park, and the same in a year later, it also became a UNESCO World Heritage Site. So people can't really go in without permission, but gorillas come out often because they don't know that there's a boundary, but they're not allowed to go out because formerly they used to range out. And people, the population growth is so high that people just kept cutting in. And there's only one part of the park that has a buffer zone, which was created to try and prevent this pressure. And they planted tea over there to provide a livelihood for the community. And also threatened by poaching. Luckily in Uganda, people don't eat primates, but in other places where gorillas are found in the wild, people eat primates, and they eat gorillas or chimpanzees because they think if you eat a gorilla or chimp, you'll be as strong as a gorilla or chimp. Whereas in Uganda, the Batwa community that lived in the forest, who are forest gatherers, they believe that if you look in the eye of a gorilla, it's bad luck. So they were actually coexisting with the gorillas. But when it became a national park, it was felt that if they live in the park, it would be very disruptive for conservation and tourism. So they were moved out of the park into settlements. And that's where most of them are staying now. But gorillas are threatened by poaching for other species, like the small antelopes, the bush pigs that people eat and still like to eat a lot. And then they get caught in snares, and which isn't good for them, and some of them die. But we had disease in the gorillas shortly after I was hired. And actually I was hired in 1996 because they were concerned that now tourism has begun, tourists can bring some kind of fatal flu like COVID-19 and wipe out the gorilla population. So they felt that they needed a vet for the park. And I was very pleased to be hired as the first vet, having done research there a year earlier. And so as soon as I graduated, that was my first job. But within 9 months of my job, the gorilla started losing hair and developing white scaly skin. And we found out that it was scabies or sarcoptic mange, which is really created by a mite coming in the skin. But then because the gorillas have never been exposed to it, it affected them much more because they're closely related to us and it came from a human being. So when you have a naive host with a closely related parasite, or pathogen, they can get very, very sick. So this poor baby gorilla died, and the rest of the group only recovered with treatment. Luckily, it was a one-time dose of antiparasitic ivermectin, and they all got better. And this happened in one group and another group a few years later. And we found out that it came from these people living around the park. People such as these are little children who are supposed to be in school, but were herding goats outside the park. And they have inadequate hygiene. It's difficult for them to get water, even if they live in a rainforest, because they have to go down a very steep hill to get it down at the bottom of the valley. And they didn't realize it was important to bathe often and to be healthy and hygienic. And they've always put out dirty clothing on scarecrows to scare away wildlife. Not only gorillas, but baboons are actually much worse offenders than gorillas, just like in other countries. But they scare away those kind of animals, and they put scarecrows with dirty clothing. So the gorillas are curious, they touched it, got sick, groomed each other, and it spread through the group. This is a banana plant destroyed by one of the popular gorilla groups. And when I asked the farmer how he feels about this, that community member, he said, I like gorillas because my children are employed by the park, and some money from tourism goes to the community, and it's helping to build our community, to build roads, clinics, schools. But the individual farmer like me, whose crops is destroyed, I'm not compensated. So that's also another big issue in conservation. So I talked to my bosses at the time, and eventually we all created a human gorilla conflict team of people who chase gorillas back when they come out of the park. And up to this day, we still work with them because gorillas still come out, because many more groups have been habituated since then. And they like to eat the plants, the banana plant, they eat the fruit, and even now they're eating the bark of eucalyptus trees that people are trying to plant so that they don't cut trees in the forest. So the community is not always happy with the gorillas. But because of tourists, they can tolerate them a bit more. So these are tourists in Bwindi viewing gorillas. Each tourist pays $600 because most of them are foreign non-residents. They pay $600 to visit them for 1 hour. And this has really transformed Uganda and transformed the local communities. Uganda used to not really benefit at all from conservation because there was hardly any tourists coming to Uganda, but now we are the country where everyone wants to come to see mountain gorillas. And each gorilla group results in over $1 million a year. And we get now about 40,000 tourists a year from gorilla tourism, which is a huge amount, and that money is doing a lot. It helps to run operations not only of Bwindi National Park, but all the other parks that are not making enough money, because there's 22 protected areas and only 5 of them are making enough money to cover operational costs. But here the tourists are following the 7-meter rule, which is good. Sometimes they don't follow it. And before I go into some of the work that we're doing with COVID-19, I wanted to talk about other diseases that have spread between humans and gorillas and chimpanzees. Like there was a measles outbreak in the Virunga mountain gorillas, because the mountain gorillas are found in Bwindi and Virunga, and it's about the same number of gorillas in both populations. So in 1980s, there was a measles outbreak in the Virunga mountain gorillas, and they suspect that it came from the local community because they also had a measles outbreak. So what did they do? The vets at the time vaccinated 80 gorillas, and they got better. They don't know if it was because of the vaccine or they would have got better anyway, but they saved whatever happened, the gorillas got better and they're there and they're growing, which is great. In Tanzania, chimpanzees got polio from sharing water sources with fishermen at Gombe National Park. And they actually, it manifested itself like humans. They couldn't walk anymore. It became paralyzed and eventually they died, which is very sad. But those were one of the first cases in the 1960s where you could suspect disease transmission between people and great apes at Dr. Jane Goodall's site. We've had those scabies outbreaks, as I spoke about, in Bwindi and in Southeast Asia, where you have the other great apes, the red orange ape, orangutan. They often get TB from their people who confiscate them from their owners. And then they've also been disease from the wildlife to the local communities, like Ebola in Central and West Africa. Gorillas are not the source of Ebola, but they get it from something in the forest, which is not yet determined. It could be a bat, a fruit bat, because Marburg is also is caused by a fruit bat, and it's very similar to Ebola, and they're the same family of virus. and gorillas have died of it, and chimpanzees have died of it, and people who ate them or slaughtered them died of it. Then we've also know that HIV in humans also came from somebody consuming a chimpanzee or having contact with chimps, and it became the SIV turned into HIV. So generally, because of all these cases, now we look, respiratory diseases can also equally spread. And more recently, we've had the human metapneumovirus infection in mountain gorillas in Rwanda, which came from the local, it came actually from tourists, because the strain was traced to South Africa. So it was not someone from Rwanda community, but most likely a tourist from South Africa. And metapneumoviruses and respiratory syncytial viruses are part of what we call the common flu. Even coronavirus, they're all part of the common flu. But sometimes it can become very severe and result in death. Just as it causes death in people, it can also cause death in wildlife. So there's also been respiratory disease in chimps in Uganda with the Rhino Virus, which is also part of the flu. Human coronavirus outbreaks in chimpanzees in Ivory Coast. They didn't die, but they detected it when they were doing disease surveys in the fecal samples. And then the human respiratory syncytial virus and metapneumovirus in Ivory Coast have been occurring over time. And they found that when people started wearing masks to visit them, these disease outbreaks reduced drastically. So it just shows that even the same methods we're using for COVID-19 worked with the great apes and human interface many years ago. COVID-19 has spread from zookeepers who are not showing signs to tigers and lions in Bronx Zoo in New York, as well as people's pets. Every time you keep hearing of a pet who has got COVID-19 from its owner, but it's not that big. It's just a very small number so far. But most recently, 2 studies have shown that humans and great apes and other primates like baboons and what you call old world primates have similar protein receptors as humans, AC2, which are the ones that the SARS-CoV-2 virus that causes COVID likes to attach very easily. That means that they're easily susceptible to COVID-19, just like we are, and we have to be very careful. So we decided to hold a training workshop with the park staff and the local community early on towards the end of March, when we started to get our first cases in Uganda. And we did it together with other partners, conservation partners, Mountain Gorilla Vet Project, International Gorilla Conservation Program, and Max Planck, who are doing a lot of research in Bwindi, and IGCP supports tourism activities. And we went ahead and held some training. This is actually a park ranger briefing tourists before they go in about the 7-meter rule. And he's showing them that this is the 7 meters. It's actually this long, because some people come in wanting to touch gorillas because of previous things they've seen on the media. And it's very important to have such rules in place and for them to understand, especially now when we think about social distancing. But when we did some research with researchers from Ohio University, we found that 60% of the time, the people broke the rules. The tourists broke the rules. They got too close to the gorillas, less than 7 meters. And 40% of the time, the gorillas broke the rules because they got so used to people. Some of them, like the one I showed you in the beginning, I knew him since he was a baby. He's been seeing tourists all his life, and he doesn't fear them. He doesn't fear people, and he likes to play with them. That's how he used to be before he died, sadly, just through falling off a tree and fighting with another silverback. It wasn't through a disease, as far as we know. But it means that it's very hard to keep the people and gorillas apart unless we carry out some more stringent measures. So if you're going up to see the gorillas, you're not allowed to go up if you're sick. That rule has been there since tourism began in the 1990s, and now it has to really be enforced. In the training, we enforced it. And then we added the element of measuring people's temperatures, because the very first index case of COVID-19 in Uganda did not have flu or cough. They were looking out for people with flu or cough, but at the end of the day, it was someone who had a temperature of over 38 degrees C. They were very observant and said, let's just keep him in and take his blood, do a test. It's actually not a blood test, but a nasopharyngeal swab. And he turned out to be positive. And the next day he got worse, red eyes, and then they started checking everyone who he flew with from Dubai and all of that. And then they declared the first that COVID has arrived Uganda. So we're using non-contact infrared thermometers, which are similar to the ones that have been used for a long time with Ebola. Uganda is bordering DRC, and DRC has had an Ebola outbreak for the past 2 years. And so we were worried about Ebola entering Uganda. So people were measured a lot at the border with the non-contact infrared thermometers because you don't have to touch someone. And hand washing was really stepped up, and disinfecting before tracking. So this is our team. We're all training the rangers in Bwindi together with the wardens and the Wildlife Authority vet officer, and everyone agreed to wear masks. This was the day when everybody agreed to wear masks. We got a local entrepreneur in the area. She's a lady who started a community-based organization for women together with her husband. It's called Ride for a Woman. And they make tablecloths and crafts for tourists. And when I called her immediately after tourism started dropping, and all the other countries were suffering with COVID, UK, Europe, US, the places where most tourists come from were all on lockdown, were locking down. She was going to lay off most of her staff because she had no more work for them. And when I called her, she was pretty depressed, and she said, I'm going to have to lay off most of my staff. So I said to her that, no, it's not necessary to lay them off. Why don't you start making masks? And she was very happy about that. And when I was in our NGOs on the National Disease Task Force, and when I was in the meeting, I asked them, where can we buy surgical masks? Because they were getting lost, we couldn't find them. And they said they're no longer there because they've been sold out. They're no more in the country right now. And I was like, whoa. Then a lady from CDC said, but it's okay to make a cloth mask with 2 layers, which is just as protective as a surgical mask. It's just not as easy to breathe through. And we thought it would be good because when you're with the gorillas, it's only for 1 hour. So we asked her to make them following certain specifications. And then now she was suddenly got a new livelihood, making masks for the park staff and other community members who come close to gorillas. So when we went out to the gorillas, we viewed them at 7 meters, as in the training, and everybody was wearing a mask. And that day it rained a lot, so we're glad to have cloth masks because they didn't get spot like surgical masks would have. And we really emphasized the issue of you have to dig a hole 30 centimeters deep when you want to go to the toilet, which happens, and now it has to be enforced because we've also seen that this same disease can spread through fecal matter. And now the wearing of masks is being done by everybody. Currently, tourism has been suspended since the end of March because of the risks to primates. I was very pleased yesterday when the president of Uganda mentioned again that we're continuing to ban tourism. We do not want our relatives, the chimpanzees or gorillas, to get our diseases. I was very pleased to hear that from the head of state. And it's going to be like that until everything settles down. And they've said that they're only allowing people to move around if they wear masks. And so it's kind of going into partial lockdown mode in a phased approach. But yesterday was the day when he said tourism is still suspended until we start to see cases dropping, because cases are still rising in Uganda, although we have very few cases. And it's mainly truck drivers from other countries. And so now it's like, okay, but that economy is locked down and people are agitated, what can be done? So it's, again, the balance between health and economics is playing up in so many ways. And so COVID-19 enabled us to review the rules for grade 8 viewing. We gave a donation of infrared thermometers to the Uganda Wildlife Authority. That's Vet Dr. Robert Aruho. He came to collect them at our office in Entebbe. And we trained a few park staff when COVID-19 ends. We actually thought it would have ended sooner than this, but it seems to keep going. But we're going to keep training more and more park staff, not only in the gorilla park, but the chimpanzee park. And one of my good friends, Dr. Jessica Rothman, who's also a researcher, donated to the chimpanzee park. And actually what we're finding is that tourists are now demanding, they're saying the tour operators that we're not going to come to Uganda unless we're sure that we're not going to make the gorillas or chimpanzees sick. What measures are being put in place? So it's so good that now it's the tourists demanding for these measures to be put into place. So we've informed them that they have to wear masks, they have to take their temperature, they have to be healthy. We don't know what will happen in the future, whether they may have to also have a vaccination certificate. We really don't know. but at least they know they are comfortable that we are putting up some measures to prevent disease between the people and the wildlife. And the park staff have to keep following them every single day to make sure that they're healthy, they're not being poached or hurt. And so they follow all these measures. They all wear masks and they all have to be clean and hygienic. And we're continuing like that. And so, as I mentioned earlier, the gorillas also go outside the park to eat people's crops. So very early on, we developed this brochure many years ago in English and the local language, how to prevent disease between people and animals. And now we put in that same information on this COVID sheet, which was designed for health people, health workers, and we've added a gorilla on there because we want to prevent gorillas getting infected from the local communities when they go outside. So this is the community conservation warden, Barbara, giving a presentation to everybody together with our team about COVID-19. And these are like gorilla guardians who are people from the local community trained to chase gorillas back. Human gorilla conflict resolution team trained to chase gorillas back. They all got these posters to put up in the public places in their community. And our team went up to train them in this. And then also the posters look like this. Basically, there's a whole part about preventing disease between humans, like as using the WHO guidelines, although we've increased the distance from 1 meter to 2 meters between people, just to be extra sure. And then also we've added a part on preventing disease between people and gorillas. So if people see gorillas in their gardens, they're not allowed to go near them. They have to call out the HUGO team, Human Gorilla Conflict Team, who are wearing masks and can safely hug them back in a way that they've been trained so that they don't get too close to make them sick. And we're pleased to have got funding from ACAS Foundation and Solidaridad, who designed these posters. And the names on the posters are the wardens of the park, the Research and Monitoring Warden and the Community Conservation Warden. So we're doing this very collaboratively with the Uganda Wildlife Authority. It's also in the local language. And we also are training village health teams. These are community health workers. In Uganda, we call them village health teams, who are trained to carry out sensitization in the communities and behavior change communication. We've been working with them since 2007, and we trained them to do conservation work. This is a typical family. So people are really quite poor in these areas, very poor. Although tourism has helped, there's still very many poor communities around the park. And we've been training them in good hygiene and sanitation to prevent diseases like scabies. And we found that now it's also very important for COVID-19. The same measures we've been using are very important for COVID-19, like having hand washing facilities and all of that. And also at the same time, we have always been promoting voluntary family planning so that someone doesn't have so many children like these, which are just almost looking the same size, and they can't feed them properly, can't give them proper nutrition, and they have to end up going into the park to poach just to feed them, and they need more firewood just to feed them. And they can't go to school because there are too many. Half of them stay at home to chase wildlife, half go to school, and in the end, they can't break the poverty cycle and they have to keep going back to the forest. So that's why we started the family planning program. And so these volunteers train people to report homes visited by gorillas, and they get back to them. And then awareness on zoonotic diseases, where we've now added COVID-19, and why the forest is important, the gorillas, and why how they can benefit from ecotourism. So these same people, of which 50% are women and 50% are men, we're really pleased about that indicator of gender. We're training them in the same things we trained the park staff and the gorilla guardians. We also gave them disinfectant over here that they can use. And this is our staff, Alex, who has gone out. He's from the local community. He's worked with us for 12 years, and he's training them in COVID-19 prevention and control. And they're all separated here, as you can see, to fit into the social distancing guidelines. So in the absence of tourism, though, it's another worry. How do we ensure the wildlife is protected? We have to support alternative livelihoods which are not dependent on tourism. And we found that gorilla conservation coffee, as much as it's dependent on tourism to a certain extent, but when you have people from abroad who can buy the coffee and travels on cargo planes, we can still buy it from farmers at a high price and reduce their need to enter the park. This is the Entebbe duty free where at the airport, where our coffee, they were our biggest buyer. They used to order coffee every week, but they've not ordered since end of March because of COVID-19. All the places are shut down. We are all struggling. And also I've talked about Right for a Woman. We're having fundraising drives for animals in the wild and in zoos, like at the Uganda Wildlife Education Center. And a lot of Ugandans are donating because nobody wants these animals to starve. But also we're realizing that we have to provide food for the most vulnerable, which is something else that we've started to work on. So it's Right for a Woman, making the masks, and in order to, as a way of pivoting their livelihood during COVID-19. And Gorilla Conservation Coffee is one that when you cross the park, when you're tracking gorillas, you cross and you find ladies like this picking coffee, and we're now giving them a better price for their coffee. And some of it goes as a donation to the NGO, Conservation Through Public Health, to improve community health, gorilla health, and conservation education. So currently we're selling it in Uganda, America, New Zealand, South Africa, and we recently started selling it in the UK, as in 1 week ago, the coffee arrived UK through DHL. Cargo planes are still flying, and Maniro Beans is now selling it to people. They've already started to sell it, and these people are able to support the gorillas without visiting them. And she's getting many more orders, and so our distributors in America, and we believe that this can be a livelihood that can grow and be independent of tourism. So before I finish my presentation, I'll speak briefly about other diseases. I know Simangeli is developing infographics for all zoonotic diseases, not only COVID, so that people can know where do these diseases come from and how can we stop them spilling over. So I'll talk very briefly about some of these other diseases that can spread at the human-wildlife-livestock interface. So anthrax is a big one. It's occurred in East and Southern Africa, and quite often. In fact, the way that we're handling anthrax in Uganda came from the lessons learned in Southern Africa. The Marburg, we've had it in bats in a cave in Queen Elizabeth National Park. Brucellosis, which I think it affects everybody, but you get it from your cattle when you drink milk and it's infected. It causes abortion in cows and infertility in human beings. Tuberculosis is very common. We all know about TB, and there's a very big TB and HIV co-infection. Rift Valley fever affects livestock and affects, buffalo and cattle, and people who work with them can also get it, and it can really affect humans. All of these in brown affect humans. These in black don't affect humans, but they affect our livelihoods, because when cows die, then you can no longer earn from them, and you can have a real case of poverty and food insecurity. So rinderpest is one that was wiped out in Uganda, but it killed very, very, very many animals in the beginning of the century, in the early 1900s. But it's now wiped out, and it's something that everybody watches that it doesn't come back. Foot and mouth disease is still quite common, and animals stop eating and drinking because they have sores in their mouth. They can't move, they become lame because they have sores on their feet, and they lose weight and they can't produce enough milk, and some of them die. And this all affects the human livelihood and the livelihood of the communities bordering the park. And then it makes them want to go in and poach buffalo, cob, other antelope, because they're so hungry. And then contagious bovine pleural pneumonia, actually we still have it ongoing. And for the same reason, when it affects the quality of the animals, it affects their welfare, it eventually affects the people and the wildlife. And I'm going to talk about how we handled the anthrax outbreak. In 2010, there was a high mortality of hippos, and the National Anthrax Task Force was developed, and that's when our organization joined it. And it was developed to contain the outbreak and prevent it spreading. And if you notice, a multidisciplinary task force, it had wildlife, agriculture, NGO, all of us were all part of this, including the big guys, WHO, FAO, and the ministries, and it was funded by USAID. A lot of it was funded by USAID. So the hippos were dying here in Queen Elizabeth National Park, considered dead hippo, and people were swimming with the hippos in the water. Can you believe it? And so there's a big risk of anthrax spreading from the people, from the hippos to the people. So we did some community sensitization. We helped to develop village health and conservation teams and community animal health workers, and trained all of them here in how to prevent anthrax disease, stopping people from eating meat from unknown sources, reporting people who are vomiting, diarrhea, and we did a lot of social mobilization. And the Wildlife Authority started to bury the hippos with lime. And the most important thing was telling people, don't eat meat from an unknown source. In other words, don't poach, don't eat poached meat, because you can get anthrax during this outbreak. And when I talk about hippos dying, as many as over 100 died in 2011, and so it was a big deal. We also carried out participatory epidemiology to see what people think about anthrax. And what we found is that most people saw that they're at risk from anthrax from their spouses, like the hunters and pastoralists. And the practices of community, they felt that traditional healers, they actually preferred the formal health services to traditional healers when it came to anthrax. So I'm not sure that the traditional doctors could treat anthrax, but only those who are very sick are the ones who sought immediate care. And anthrax can kill, but it's treatable. Unlike COVID-19, it's actually very highly treatable very quickly, just by taking penicillin. It's not as infectious as COVID-19. And we found that most of them preferred social mobilization to posters, TV, phone, or even radio. And their level of knowledge varied according to how close they were to the park. I think the closer they were to the park, the more aware they were of anthrax. And so this enabled us to carry out a sensitization. After creating 30 community conservation health workers, we talked about eating meat from unknown sources, going to the hospital when you're sick, improving hygiene and sanitation, not drinking water from the lake without boiling it, and trying to stop cattle sharing sources with wildlife, because the cattle were also getting sick from anthrax. And we helped to create a disease outbreaks website, toll-free hotline, SMS short code. Very many people were reached through these channels. And what we found is that at the end of all this outbreak, which took about 3 months, no people died of anthrax, and it helped our NGO to be a runner-up in an award for Uganda Communications Commission. These are all the groups of people we worked with. What we learned from this was that in 2004, when there was a bigger anthrax outbreak, over 300 hippos died, many other animals were affected, and 200 people got sick, and 6 people died from eating infected hippo meat. And it had a big impact on the community livelihoods and ecosystems, and many tourists were scared of coming to the park as well. But in 2010, fewer hippos died because we got together as a multidisciplinary force and quickly went into action and helped each other. We moved along, the health people, the wildlife people, the veterinary people. And so we lost less hippos, we had no human deaths, and cattle were vaccinated very quickly. And also there was much reduced negative impact on livelihoods and ecosystems. So One Health approaches work. And we believe that to prevent the next pandemics, we need to look at One Health approaches. The wildlife community works closely with the veterinary and the human health community. And in that way, we'll stop spillover and prevent future pandemics, such as COVID-19. And these outbreaks, I have to say, have occurred all over the world, and especially in Africa, and in Southern Africa and East Africa. And actually in Southern Africa, they recommend not to burn the hippos, but bury them. They recommend to actually put acacia thorn on the hippo so that when the vultures come, they can't break open, because when they break open a hippo carcass, it opens up and the spores come out, and then they stay for very many years, several decades. But if you stop the carcass opening, the spores die after 72 hours, and you really stop the spread, even future spreads. So we're learning a lot from the Southern African experience. So for more information, please visit our website. Thank you very much. And follow us on Facebook, Instagram, and Twitter.
Thank you so much, Gladys. So often we hear of diseases that come from animals, from animals to humans, but it's very less often that we speak about how they move from humans and to animals and the effects that they have on the animals as well. And for me personally, another part that I really appreciated is sometimes we get so hooked up on the disease that is affecting the humans, but not so much on what is the host animal, basically. And that lesson from specifically from the hippos that you just touched on and how to prevent it was very informative. And lastly, I'm really excited with this. I always get excited when we get a solution-focused presentation. So much we learn of the problem, of the dangers, but to get a few case studies, specific ones from Uganda of how you've dealt with it and how you're currently dealing with it is actually very encouraging, because then it's something that other countries can learn from. Colleagues, I can see that, thank you so much. There's 25 of us in the call. We do have 15 minutes for questions. So if you have any question for Gladys, now is the time to ask. Okay, so while no one has a question, Gladys, I have the first one. You obviously have a lot of lessons from Uganda and solutions that you've implemented to the different pandemics that you've had. Are there any plans to collaborate with other NGOs in other countries so that similar regulations that you currently have in your country could be replicated elsewhere? Like an example, you spoke so much about the 7-meter rule when people are viewing gorillas. Is that happening elsewhere as well? And yeah, beyond that one, if there's any plans to take the work that you're doing beyond Uganda. Yeah.
Yes, thank you very much for that question, which is great. We definitely do want to expand, and I would say we do want to carry on these lessons learned, working with other people in other countries who are working with great apes, for example. And right now, Uganda and Rwanda have similar, and actually DRC as well, as far as the mountain gorillas go. We all have some basic rules which are the same, which is, keeping the 7-meter distance, wearing masks has now become something that all 3 countries are doing. COVID-19 has enabled that to happen, and taking temperatures and all of that. And we know that other countries in Africa have tourism. They want to, it may not be at the level of Uganda and Rwanda, great ape tourism, but they want to develop it to that level. And so we definitely want them not to make the same mistakes we have made, and make sure that they also have high standards right from the very beginning, because it will really make a big difference. And at the beginning, people are not so fast about the rules, they'll follow them. But the point comes when you start to have a lot of money coming from tourism, then things start changing. And actually, that's what we found in Uganda when a lot of people came. We suddenly had so many tourists. It happened over time. It became harder to keep the rules going, because you found that, how can I offend the customer? The customer wants to get close to the gorillas. If I offend them, then maybe now becomes a question of economics. But now it's very good that the customer is demanding that they don't go next to the gorillas, and it makes a big difference. And we believe that all these other countries could also face that same pressure when their tourism goes really high, and we need to caution them ahead of time. So yes, we're definitely sharing. There is a IUCN Great Ape Specialist Group and Tourism Specialist Group, for which I'm on those committees now. And I'm really glad I can influence things. I mean, they're developing a lot of guidelines for all primate areas, but you need us people on the ground to make them a reality, because we're the ones on the ground working with these species. We're the ones who can influence our governments. And so they really need to work with the local NGOs to be able to make it a reality. And so we're working closely with them, and I'm glad to be able to do that. And also, we're so glad to get lessons learned on how to handle anthrax and all these other diseases. Sitting on the task force of Uganda, National Task Force, currently right now, CTPH, our NGO, and Uganda Wildlife Authority are the only conservation organizations there, but we really want to encourage other conservation partners who feel that this really is something important to them to also join these task forces, because the more of us join them, the better that there will be regulations that help everyone. Yeah. For example, in the task force meeting today, I said to them, I suggested that they can do community surveillance. They're already doing community surveillance in the districts where the gorillas are, which is great, because those are the border districts, but they're only stopping many at the border right now. And I recommended that, I made a plea, having spoke to other conservation partners, can you please survey the park staff? Because they've never been tested for COVID-19. In Rwanda, they managed to test them. In Uganda, they haven't yet. They said it's a lot of money. We have to prioritize who we test. And I said to them, we have to prioritize the park staff. They're the ones who visit these primates. And also they get into contact with foreigners from all over the world. They're a target group that should be surveyed. And they agreed, they said, that's a brilliant idea. So when we sit on such committees, we can help to influence change in the areas where we work.
Yeah, thank you so much. Flavia, I can
And
see.
actually, I just wanted to add, Simengeli, that you're also part of the process where we're developing a policy brief for African governments on these very issues.
Yeah, thank you. Flavia, I'm keen to give you a chance actually, because I see you've written something in the comments section. So if you're keen to take the floor, please take the floor so that you ask your question directly to Gladys.
Okay. Hello, can you hear me?
Yes, I can hear you.
Hello, Gladys. Thank you for your webinar. It was very inspiring for me. I was working in Brazil with climate conservation also, so for me to hear about the coffee and the other solutions that you are having to make some money, to put this money in conservation is very inspiring. So think about this. I am just curious about the coffee. Now with the COVID crisis and with the reduction of tourism, only the coffee commerce is enough to maintain the work with the gorillas during this time, or are you having some other fundraising?
Yes, thank you, Flavia, for that question. It's a very good one. And actually, someone else has asked us that question, actually. Is the coffee commerce enough to protect the gorillas? Well, it's making some difference. You know, we're engaging 500 farmers currently around the park. Difference. And one thing that we have to do, of course, is to increase our marketing so that we can make sure that the loss from tourism can be replaced by getting more suppliers from other countries. So that's for sure, we have to do a lot of that. But another thing that we realized that we have to do is not everybody's a coffee farmer. So we are thinking of providing crops to the community that grow quickly so that they can start to eat. Because a lot of people, when tourism began, they stopped farming because it was easier to make money as a porter. You know, you get like a minimum of $15 or $20 when you take a tourist tracking. And that was actually quite a lot of money for the local communities. And they were like, well, why don't I just do this? And why do I bother digging? You know, it's too much work. So a lot of people abandoned farming when the tourism industry really picked up. And now we've had a loss of tourism. And this is not the first time we've had a loss of tourism. One time we had a loss of tourism when we had insecurity in the park. But then we've even had a loss of tourism a few years ago during the Ebola in DRC. There was a dip in tourism, but it didn't get to the level of COVID when there's no tourism at all. And so now it's really, people are very hungry and they're depressed, and a lot of people have been laid off in the lodges. So, you know, because they don't have money to pay them. So we are thinking also as an NGO and teaming up with other partners on the ground who are good in agriculture to get them to grow in a sustainable way, crops that can grow very quickly so that they can eat, and also trying to see if other groups can find other markets for other crops. You know, like there's tea, there's so many other crops that maybe they could go beyond their immediate vicinity so that they can provide food to other communities in other places. But it is very sad that COVID-19, some of these people grew vegetables for the lodges, but the lodges are not operational right now because there's no tourists. Until the tourism begins again, they don't have a market, but they need to eat. And that's one thing that we forget in conservation. People need to eat, and that's often the reason why they poach. So we have to help them in one way or another.
Yeah, thank you so much for that question, Flavia. Actually, I can relate with it so much. So I stayed in Duba, which is close to St. Lucia, a tourist town in South Africa, just close to Ismangaliso Wetland Park. And currently a lot of communities of local people are surviving through food parcels from the government and other type of aid because they rely so much on tourism, not necessarily only as workers in the protected area, but they go there to sell fruits and vegetables to the tourists. They are selling craft work, and with tourism closed, it just means there's no income for local communities. And in this context, in our context, a lot of NGOs have stepped up to provide this aid. But interesting enough, one of the NGOs is actually donating seeds and seedlings to try and motivate people to grow their own food, with the understanding, of course, that one of the opportunities is to encourage people to grow their own food in case of any future pandemics or any other thing for that matter, in a country like ours where there's a high poverty rate. I'm going to allow the two last questions, Gladys, that are in the chart. One of them, I believe you had answered it, but you can add a bit more if anything was missing. It's a question from Emmy that says, are there any laws or regulations in place to keep tourists away from the apes? How can such things be more effectively reinforced? And another one is from Sweta. Have you heard of any cases of COVID-19 in primate populations yet? Yeah.
Okay, thank you. I can start off by answering, okay, I'll answer Amy's. There are regulations in place, and it's just COVID-19 has enabled us to strengthen those regulations. There are regulations in place in Uganda, Rwanda, DRC, and I believe they're also there in Tanzania. And each of these sites we find have site-specific regulations, but there are also some general regulations of, you know, the 7-meter distance has now become standard. When I first started working with gorillas, it was 5 meters, but now everyone thought, actually with 5 meters, people were breaking the rules. Let's make it 7 so that it's harder for them to get too close to the gorillas. And so that is probably the most important regulation that people have to follow. Just like with the pandemics, we're finding social distancing is still the most effective measure of preventing spread of COVID-19. The same with our social distancing from gorillas. Unfortunately, they can't social distance among themselves, but at least we can social distance between us and them. But then also, you know, all of these other things like, you know, wearing of masks has become standard now, at least in the 3 countries where mountain gorillas are found. And I think going forward, it's going to be standard because now everyone's realizing it's not so difficult to wear a mask because I have to wear it anyway to protect myself from, you know, giving someone else COVID or getting it from somebody else. So now it's going to be easier to enforce it when tourists come. So these rules are coming up and we want to make sure that government makes them more institutionalized and they're not just guidelines which can be changed very quickly, but they really become more enforced. But that's an area where if you have any suggestions, Amy, you can send me an email later because it's an area that everybody's grappling with because sometimes the regulations are not always followed. And then any cases of COVID-19 in primates? Thankfully not, thankfully not. We're crossing our fingers that it's not going to cross to the primates because they don't know how to social distance. There was actually a recent article saying that gorillas are going to be worse off than chimpanzees because chimpanzees generally move, they don't hang out together so much. You know, they generally move on their own with their 2 or 3 children. They don't like gorillas move in a harem with 1 male and many females and many babies, and they move together. So if it gets into one gorilla, it will affect all the other gorillas, whereas chimps social distance a bit more. So the primate species that social distance more will get less affected than the ones like gorillas that live in a harem. But for example, the regulations, even in the lemurs in Madagascar, they have similar regulations to what we have here in Uganda. Yeah, I think I've answered those 2 questions and hopefully it won't get into the primates and we're really looking out for this. And that's why the people who come into close contact with them, we really feel now it's important that they're tested, but more importantly, they know what to do to prevent disease from themselves to the primates. And that's the area where we're working very hard on.
Yeah, thank you so much. We've reached the end of the hour and I believe we've used the hour very much fruitfully. I would love to end by thanking everyone who managed to join us for this webinar. And I'm really hoping that you'll be sharing all the lessons learned with other people. And a special thank you to Gladys for agreeing to do this at such short notice. And also I'll end by just bringing attention to the other work that we're currently doing with Gladys on the side. So we're working with other African civil society organizations, as she mentioned briefly. one, to put up a campaign teaching people about zoonotic diseases in general, because we've realized that there's so much misinformation out there. People don't really understand that there are diseases that move from animals to humans and vice versa, and how to prevent them. And secondly, just pointing out how this could be avoided in the future, highlighting the role of wildlife trade and consumption in this, and how better regulations can be shaped. And secondly, how there's some evidence that habitat destruction and deforestation is actually increasing chances for zoonotic diseases to spread. So we are currently in a state where we are making infographics for educational purposes. But as also Gladys was saying, we are putting together a policy brief just for recommendations to African governments, because of course these regulations that exist in Uganda and Tanzania, they currently don't exist in other countries, or if they do exist, they exist for a limited number of animals, like it's very specific to gorillas. So we need to open the question wider of, can this be applied to other animals as well, because the tourism sector is big and there's a lot of animals that people go out there. Is there potential that people are actually making those animals sick and vice versa? So for anyone who is based in Africa specifically and is keen to join for that sort of work that we're currently doing, while we are saying we are realized that there's a pandemic, but what opportunities does this pandemic come with? It's opportunities to teach people, it's opportunities to change some policies, and we are currently working on that. So you're more than welcome to either get in touch with myself or with Gladys with the same contact details you used from the poster, and also with the email address that I just put on the side. And from me, thank you so much, and have a great evening or a great day if you're in a place where it's still the morning. Yeah. Bye.
Thank you very much, Simangeli, and everybody.
Bye.
Gladys and Simangle for organizing this. It was really good. I think a lot of people are already telling us in the chats that they're really happy they had this opportunity. So we're hoping we could have some more talks like this in the future so we can learn more. But yeah, thank you once again for all the effort and having this idea to even have this webinar with us.
Yeah, thank you. Bye.
Thank you all.
And
Stay safe and healthy.
to everyone.
Bye-bye.